Hello, everybody. My name is Deborah Vito Vittorio, and for my topic, I chose to cover acute care. Acute care is defined as the level of health care in which a patient is treated for a brief but severe episode of illness. It usually requires immediate treatment for conditions resulting from a disease or a trauma. Inpatient units such as medical, surgical, cardiac, ICU, emergency departments are examples of acute care settings. Currently, many COVID-19 patients are usually seen in these types of units or this level of care. Currently, the COVID-19 pandemic has affected everyone's lives throughout the world. Therefore, I chose a current event article on COVID-19 and how it has impacted acute care. This article is from Becker's Hospital Review and it was published on July 28, 2020, and its title is What COVID-19 Means for the Future of Acute Care. This article discussed how the novel coronavirus has changed the way healthcare is delivered in acute care hospitals, and it highlights the areas that were impacted. I'll discuss this in the next slide. The article reported on the COVID-19 lessons learned. Primarily, it discussed how COVID-19 should be used as a change agent to expand current traditional healthcare delivery, which is in person, to shifting towards virtual care. This entails the rapid changes seen in many clinics to implement telehealth to diagnose, treat, and follow up with patients. Another area discussed was improving access to emergency care. Mr. Rawson, president of California Adventist Health, gave a statement during the COVID-19 surge. He stated, organizations were not able to meet the needs of community for non-COVID related illnesses. Many patients were afraid to go to the emergency room in fear of contracting the virus, therefore many did not seek help early. This could result in a surge of non-COVID patients as well as harm done to the patients if they're not seeking care when needed. Therefore, there needs to be a mitigation plan to meet the needs of every patient at every encounter. Lastly, the article touched on fragmented care and how it contributed to poor outcomes. When introducing virtual care to acute care settings, it's important that multidisciplinary teams communicate well and keep track of their patients and place their care as priority. From my research, fragmented care in acute care can lead to poor health outcomes, especially amongst patients with chronic illnesses. Dr. Corey also gave a statement. In the past, patients have been lost by healthcare systems and could see a situation where even more are lost virtually. Care navigation just becomes even more critical in this new world. When caught in any kind of emergent situations, especially an unexpected pandemic, the vulnerabilities of the healthcare systems come to light. Many lessons were learned in COVID-19 and hopefully it will be used to make a positive change in the delivery of healthcare, which would lead to positive health outcomes in the patients. Moving on to the analysis, having read the article thoroughly, is there bias in this article? So this article is sponsored by Vituity, which is a physician-led organization, and they were pushing for virtual care provided by their organization. So there was a little bias present. However, I believe it was very informative and applicable across many clinical settings. Is there a common or expected bias regarding COVID-19 and acute care? Sadly, I believe there's a common bias built regarding COVID-19 as it has become a political issue amongst many places. While many believe in it, there are also those who don't believe in it. This will impact patients, but also providers in acute care settings as they can build an unconscious bias, which can change their course of actions. Thank you everyone for tuning in into my current event presentation. Here are the questions I would like for you to answer.